Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 49 of the podcast. Today is December 7th, and welcome to a brand new month. We're about to say goodbye to 2020 and say hello to 2021, and I'm excited for that. I'm excited for the new year, and today we're going to cover my top pro tips for passing the CPMA exam. You heard that right, passing the CPMA. So I just took the test about 3 weeks ago, and I'm happy to report that I passed it, and I want to share some helpful tips for you so that you can do the same. And if you have not done so already, make sure to check out the December edition of Healthcare Business Monthly. I'm actually featured in the Officer Spotlight as the Orlando, Florida chapter president, and I also wrote an article that was published about productivity and efficiency. So definitely check those out in Healthcare Business Monthly. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip, and it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today and visit projectresume.net and mention my code ALPHACODING for special pricing. So our Mindset Monday tip is all about multitasking and why it doesn't work. The quote I want to share with you says, "The person attempting to travel two roads at once will get nowhere." And I firmly believe this because I've actually seen the negative effects of multitasking firsthand. I've seen it in myself. I've seen it in my team. I've seen it over my career time and time again. We actually operate best under monotasking, which is focusing on one task at a time and not trying to do two things at once. Our best thinking is actually impaired when we try to multitask. The thing is, we've all been programmed, conditioned, I would say over the last 10 years with the rise of smartphones and social media. We're constantly flipping back and forth, checking email, checking apps, checking notifications. So we've all been conditioned to multitask, but understand that it is very ineffective and it can cost you a lot more time and effort and can lead to a lot of careless errors. How many times have you been talking on the phone while you're typing an email, and when you get off the phone and you go to look at the email, you realize that your email makes no sense, or you've made some crazy mistake, or you accidentally clicked reply all when you actually meant to reply just to that one person? These are the types of careless errors that can be catastrophic to you. So totally avoidable. Focus on monotasking, not multitasking. You're going to see great results. So today we're going to cover my top 10 pro tips for passing the CPMA exam. And so for those that don't know, the CPMA is the Certified Professional Medical Auditor credential offered by the AAPC. Now, I did an earlier episode which I talked about passing an upcoming AAPC certification exam. Check that out, episode 45. But today's episode, I'm really going to focus on the CPMA. Since I just took the exam, I had the experience, and I feel like I have some great tips that I can share with you. I also want to share that I have been auditing for a long time. I would say almost a decade. So I didn't come into this having never audited. I had a really strong working knowledge of the principles, and a lot of what I had to focus on was the regulatory compliance. So if you're coming into this and you've never actually audited before, then it's going to be a lot more difficult for you to pass, because this is really a test that's built for somebody that has a strong working knowledge of the industry. So as the industry continues to adopt AI and natural language processing, we're going to see a lot of coders shift from primarily a coding role to more of an auditing role. Now, does this mean that AI is going to replace coders altogether? No, I'm not saying that. And I do think that there are specialties that are complex enough that are going to still require coding professionals to do the frontline coding, but a lot of coding roles are going to shift more into auditing roles. So this is why I'm a huge proponent of the CPMA. I think it's one of the best credentials that you could invest in, and it's going to continue to be an in high demand as the industry continues to evolve. And this brings me to my pro tip number 1. Know your regulatory guidelines. So you really have to understand all the regulatory guidelines, the False Claims Act, the Anti-Kickback Statute, civil monetary penalties, Stark Law, all of these things you have to be familiar with. You also have to understand what penalties and fines are associated with each of the laws and what programs they apply to. There are also a lot of questions about HIPAA. So these are areas that you really want to focus on. You're also going to need to know the definitions and the practical applications of fraud and abuse. So it's not enough to just memorize the definitions. You actually have to know examples, concrete examples of what these mean. So definitely focus on the regulatory compliance guidelines, all of these different statutes and laws. Pro tip number 2, you will need a working knowledge of evaluation and management auditing. So if you've never done evaluation management auditing or even coding for E&M services, it's going to be really difficult for you to pass this exam. So they're not just asking you to code out services, they're really asking you to look for what's missing and know it at that higher level. So you're going to have to understand the guidelines, both 95 and 97, and in 2021, you'll have to understand the 2021 guidelines. So again, that's just a month away. You also need to understand your modifiers associated with E&M, how those apply. You're going to need to understand incident to compliance in the office setting versus split shared services in the inpatient setting, and understanding the guidelines and how they apply. They're not just going to ask you about the definitions of these guidelines. They're going to test you on how to apply these concepts to case examples. You also need to be familiar with the different audit tools that you would need depending on the type of audit that you're conducting and the specialty that you're auditing. So this is going to require a really high working knowledge of E&M auditing. Pro tip number 3, you will need a working knowledge of surgical auditing. So again, if you're somebody that's never done surgery coding, maybe you've only done E&M coding or vice versa, that's where you're going to really have to do your homework and do a lot of case studies and examples to get yourself up to speed to be able to pass this exam. There are a lot of questions on both E&M and surgery, so it's not like you can do well in one and not do well in the other. Because of the way that the exam is structured, you would miss too many questions to pass the exam. So as far as the surgical auditing, you want to know the surgical audit tool, the ins and outs, all the requirements of operative report documentation. You especially want to know the surgery modifiers 58, 59, 78, 79. You have to know these like the back of your hand. You're also going to need to know the global package definitions, what's included, what's not included. Again, they're testing you at an expert level. Pro tip number 4, you will need a working knowledge of the NCCI edits and the MUEs. This is imperative if you've never accessed this database. Now it's going to be the time to teach yourself how to understand it and interpret how to read the columns, apply the CCM rules. So you really have to have a strong working knowledge of how this applies, because it's never as simple as these two codes can or cannot be reported together. When, for example, modifier 59 would be appropriate, what documentation would be needed to support that additional procedure with modifier 59 appended. So it really goes to that deeper level. And you also need to understand the MUEs and how that affects, for example, multiple procedures and bilateral procedures and how those are reported. So you'll need to understand how many units are allowed for a date of service and how that applies to different procedures. So again, if you're a coder that hasn't accessed these resources before, you definitely want to spend some time understanding how this works at a high level. Pro tip number 5, study infusion coding. So I had a ton of questions on my tests about infusions, injections, hydration, chemo, the units on all of the services, the units on the drugs. So you definitely want to go through the CPT guidelines for these code sections, highlight them, understand them. They are quite complex. There are certain sections of CPT that are pretty straightforward, but there are sections that are really difficult. And this is definitely one of those sections that if you haven't worked in hematology, oncology, immunotherapy, it's going to be really difficult for you to understand this at that high level. So you're going to have to invest invest the time and actually break out those case studies and practice, and then backtrack on what the rationale is, and then give yourself enough time to retest and make sure that you're getting the concepts. So there were a ton of questions on these services. You definitely want to spend a good chunk of time understanding and learning them. Pro tip number 6, study the statistical sampling methodologies. So again, if you haven't spent a whole lot of time in the audit world, you need to understand the types of audit. So is it a baseline audit, which would be a random audit, or a focused audit? Is it retrospective or is it prospective? You need to understand all of these things, and then the subcategories. And with the sampling methodologies, this all has to do with making sure that you have a statistically valid sample for the audit. This is all of the pre-audit work. Before you actually get into auditing the records, you have to make sure that your audit sample is meeting that scientific sampling methodology. So this could be proportional, numerical. This gets really specific and technical, so you definitely want to spend some time studying this. And then you want to understand what the RATstats OIG software is. My friend Victoria Mull did an awesome YouTube video on this where she actually walked everyone through how to access it, how to use it. It's not the most user-friendly database. It's a free software, but it's imperative that you understand how it works, and seeing how it works can really help kind of put it all together so that it clicks. Pro tip number 7, understand the application of controlling standards versus persuasive standards. So controlling standards are the standards that providers must follow, and persuasive standards are things that they should follow. The controlling standards examples would be things like state law, federal law, case law, or it could be commercial payer contracts, incorporated standards. And persuasive standards are providing guidance when there's no statutory, regulatory, or contractual provision to address that scenario. So some examples would be CPT Assist, Coding Clinic, and it's imperative that you do not confuse these two standards, because if you are alleging in an audit that there is an error, there has to be something to back that up. And you can't use a persuasive standard to defend the audit. It can be used as an educational note, but a controlling standard is going to take precedence. So understanding the application of controlling standard versus persuasive standards, there were a lot of questions about this on the test. Pro tip number 8, read the AAPC study guide for the CPMA exam from cover to cover. So this resource is invaluable. I talked about this in episode 45. Any certification exam that you take, you want to get the AAPC study guide or the AHIMA study guide, whichever organization you're testing with. But I'm telling you, the study questions, the practice exam in that book, some of the questions and examples are verbatim on the test. So read it from cover to cover, mark it up. I thought it was very helpful in preparation for the test. Pro tip number 9, take the practice exams. This is where I see a lot of people cut corners. They don't take the practice exams. Both the study guide questions, the exam in the study guide, and the practice exams are laying the foundation for what you should expect to see on the certification exam. Some of the test questions are verbatim from these practice exams. So if you go ahead and take those exams, you're already going to be familiar with the answers and the rationale, and this is going to help cement that in your brain. So definitely take these exams. Don't skip the case studies. Specifically for the CPMA, there are multiple case studies in these practice exams. And the reason why they do this is because they're trying to help you work up your endurance, because on my CPMA exam, I believe there were 24 case study questions. So these are like 5-page long reports that you're flipping back and forth trying to figure out what the appropriate guidelines are, the codes, the questions, if there's any missing information. So this is the most difficult part of the exam, the case studies. So doing the case studies beforehand is going to help you significantly because it's going to lay that foundation for the test. Pro tip number 10, believe in yourself. I said this before and I'll say it again because it's worth repeating. If you don't believe in yourself, then don't even bother showing up to take the test. I walked into the test with the mindset that I was going to pass that exam. I didn't doubt myself for 1 second, even though the test was hard. It was brutal, even though there were a lot of questions that I didn't know the exact answer to. I knew that if I controlled my mindset, if I believed that I was going to pass, that ultimately I had done the work to do so, and that would be the result I got. Guess what? I checked my app pretty much every day, 50 to 100 times a day until I got those exam results. But when I got them, it's almost like I had already visualized that moment in my mind before I even took the test. So you really want to focus on that belief, because that belief is going to manifest into an outcome if you put the work in and believe in yourself. So trust me when I say believing in yourself is going to be the key to your success. So grab a pen and paper to summarize my top 10 pro tips for passing the CPMA exam. Number 1, know your regulatory guidelines. Number 2, you will need a working knowledge of evaluation and management auditing. Number 3, you will need a working knowledge of surgical auditing. Number 4, you will need a working knowledge of NCCI edits and MUEs. Number 5, study Infusion coding. Number 6, study the statistical sampling methodologies. Number 7, understand the application of controlling standards versus persuasive standards. Number 8, read the AAPC study guide from cover to cover. Number 9, take the practice exams. Number 10, believe in yourself. So it's time for this week's coding pro tip, and it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering an exclusive special to Alpha Coding Podcast listeners, and that's $125 off the Certified Risk Adjustment Coding Prep course when you order through our affiliate website. This course has a 100% pass rate, by the way. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. If you have a coding-related question and would like to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from Louisiana. Hi, Toni. I need some advice for my new job. I was hired as a patient service coordinator for a hearing aid office in my area. Can you help direct me to a resource that can help me understand coverage criteria and any other resources you think would be helpful for audiology? So it's always great when you get into a new specialty to kind of understand what the resources are that you need in your toolkit. So definitely take a look at the American Speech Language Hearing Association, also known as ASHA. And according to their guidelines, some states require that health plans in the state pay for hearing aids for children, while other states require both children and adults. Keep in mind that certain insurance plans are exempt from state mandates. So specifically in your state, Louisiana, there is a state mandate that requires children under the age of 18 be covered for hearing aids, and those are fitted and dispensed by a licensed audiologist or licensed hearing aid specialist. They do have to be cleared by a physician first, and this is specific to children. So in the state of Louisiana, there are not currently any mandates that require health insurers to cover hearing aid devices for adults. Now, there are other states that do have that coverage mandate. So I would advise taking a look at the ASHA website, and then definitely take a look at your state Medicaid resources, do an inventory of your major payer mix, and then pull together all of their coverage policies. So I hope that points you in the right direction. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire Alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.